Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to see one more topic under rheumatology, that is, let's take a case. A middle aged woman presents with dry eyes, noting point, dry mouth and difficulty swallowing dry food. After seeing all things, what you will be noticing is there will be no secretions. So any idea why secretions are less? Yeah, let's see why secretions are less under the topic. So, what is today we are going to learn about Zika syndrome, very important topic under rheumatology, and it goes like this. It is also called as Sjogren syndrome. Maybe you are familiar with the Sjogren syndrome name. Zika syndrome is recently updated. Sjogren is a chronic autoimmune disorder characterized by lymphocytic infiltration and destruction of exocrine glands. Any idea about exocrine glands? What is its function or any examples you know? Yeah, exocrine glands are like they produce secretions like saliva, milk, tears, or etc. What are the basic function is like it's maintaining temperature, digestion, or even lubrications or else. And most common examples you need to know under exocrine are salivary gland, mammary gland, sebaceous gland, or even lacrimal glands. Okay, that was a brief brush up of exocrine glands. So let's come back to the topic, which leads to dryness of eyes and mouth, as I said in the case. It occurs as primary or secondary. We have two. Primary means just in general I wanted to say primary means it will be the actual cause for the condition. Secondary means it will be always contributing factors will be affecting to the cause. I hope that was clear. So there are two types. We have primary, then secondary. As I said, in primary it occurs alone. No associated connective tissue diseases will be seen. In further videos, we'll be saying connective tissue disorders as CTD. Okay. Yeah, let's make topic simple so that you can remember better. Secondary associated with, as I said, other factors will be contributing like rheumatoid arthritis, SLE, or systemic sclerosis. You can go and watch these videos. These are also very important topics which are available in this playlist. Then coming to pathogenesis, autoimmune activation against exocrine gland, as we discussed, which leads to lymphocytic infiltration of salivary and lacrimal glands. These are the good examples of exocrine gland, which leads to destruction of glandular tissue. At the final stage, it causes reduced secretion. And just think, having a dry mouth whole day, how it feels. For half an hour, you can't control your thirst. And this lady will be undergoing this for a long time. So what is the key role in this disease development is autoantibodies. Rheumatology, just remember, most of the things will be related to antibodies. And coming to clinical features, just may apply your common sense. If there is secretion less, then you need to see where all secretions are produced. So in eye, there will be tear. So there will be reduced secretion of tears, which leads to dry eyes, gritty or foreign body sensation. Just feel your upper bulbar conjunctiva, and there will be softness because there will be secretion under the conjunctiva. But if there is no secretion, you will feel the papillae like nodules under the upper palpebral conjunctiva. So this is why it is felt gritty or foreign body sensation. Then burning sensation will be seen due to dryness. And if there is a dryness or burning which leads to redness, and photophobia is a complication. Then coming to oral, if there is a dry mouth, obviously there will be difficulty in swallowing of dry food or any food. Then what happens? Dental caries will be seen. If the person is not having wet mouth or something, if it is dry, dental caries is the most common complication you will come to see. Then oral candidiasis, it is just because complication of dry mouth. Then parotid gland enlargement will be seen. Systemically, you will going to see if you don't drink the water, you will feel tired, right? That's what happens in this patient. Fatigue will be seen. Fatigue, arthralgia, body pain, Raynaud's phenomena. It's a surgery topic. You can go and watch wherever it is available. Then extraglandular manifestations, ILD will be seen, renal tubular acidosis, just because there will be no fluid in the body. Then peripheral neuropathy is seen, vasculitis, then increased risk of lymphoma. So I think clinical features, this time I made it very simple with points. If you want to add on extra points, just no need to add. These are the sufficient for 1 mark when it comes for 5 mark. Don't bulk the answer, you won't remember anything. Then coming to investigation, autoantibodies you are going to check. In that, mainly you need to remember anti-Ro was a old name, SSA is a new name. It will be most commonly investigated for the diagnosis of this Sjogren syndrome. Okay, and other are like ANA will be positive, anti-La will be seen. Then functional test, Screamer's test, reduced tear production. You better learn this in under the topic of dry eye. Wherever it is available, you can just go and brush up your knowledge about it. Screamer's test, it's a 3 marker in ophthalmology in 3rd year, I guess. Yeah. Then salivary gland function test, just because like there will be dry mouth, the thing which will be making wet oral cavity will be saliva, and we have to check whether it is functional or not. Then coming to histopathology, labial salivary gland biopsy shows lymphocytic infiltration, which I explained in the definition itself. Then after seeing all this story, you have to manage, right? So let's see how we will be going to manage the thing. Symptomatic treatment, like if there is a dry eye, you are going to give artificial tears, then saliva substitutes, then good oral hygiene. Obviously you need to prevent the oral candidiasis, right? Then systemic treatment, hydroxychloroquine you are going to give, corticosteroids if systemic involvement is there, like example rheumatoid arthritis or other diseases in giving extra manifestations, so you have to treat them. Then immunosuppressive drugs in severe diseases. Then coming to what you have to monitor in this patient, regular follow-up for lymphoma development. Yeah, most common will be non-Hodgkin lymphoma. Yeah, coming to complication, there will be dry eye, so it leads to corneal damage, giddiness and all. You will be rubbing, redness will be occurring, photophobia, and at last it leads to corneal damage. Then coming to oral cavity, it leads to dental infection due to dry mouth. Then lymphoma, most commonly non-Hodgkin, as I said. So this time we are adding examples, what important points you need to remember under this topic, so that you can write some stories if you remember these points in the final exams or your entrances. Examples, you need to remember dry eye. It was it beating around the dry eye and dry mouth, all are the hallmark features. Then anti-Ro was the important investigation, we called it as SSA. Then Screamer's test for dry eye confirmation, increased risk of lymphoma. Which type of lymphoma? Non-Hodgkin lymphoma, right? Then coming to quick recap, Zika syndrome is an autoimmune disease. You need to read with me so that you are going to remember this 2 lines, which however you want, you can stretch the answer in the exam. Zika syndrome is an autoimmune affecting exocrine glands. I said the examples of exocrine gland, causing dryness of eyes and mouth, and clinical features will be beating around these things. Always think of Sjogren syndrome in patient with persistent dryness and